I'm here for the vaccine. This has been an incredibly long journey for most of us here at the health department, being deployed in helping our community. And so this is a little bit of hope at the end of a very, very long tunnel. And I'm really hoping that our folks here at the health department, but also Fairfax County, go out there to get the vaccine when it's available to them. Because we need to end this pandemic somehow, and unless we have, 70% of our population being vaccinated here, we're not going to get herd immunity. And so it's really critically important for us to be able to stop this pandemic and to maybe resume a normal way of life again. I've been deployed since April with the response, and I've been called up to be the testing branch director here. So we do testing. So it began as testing, with point prevalence surveys over at the long-term care facilities, helping them mitigate the spread of COVID-19. Then our role transitioned over to community testing, where we went into the vulnerable populations to provide diagnostic testing for communities that need access to testing. And currently now we're doing fixed site testing, where the community is coming over to us during this difficult time. One of our recent community testing events, where we went over to Hutchinson Elementary School, the principal there were saying, the families are really in dire straits. A lot of them are almost to the point of losing their homes because they're not able to pay rent. They really need access to food. It's the ability to really help those folks, not just with the testing resources that we have, but also to connect them with the needed resources that they need to be able to provide for their families.